I think the first stage really is you have to talk to the person who's affected, because you need to have them on side with the idea of having some help. And if it's a child or a teenager, then as a parent you're quite likely to have to talk to them first before you go looking for help from professionals. If the young person is willing to have some help, then there are a number of ways you can go about it. For most people, the GP will be your first port of call. Some GPs are more familiar with eating disorders than others, but these days most GPs will know about eating disorders and will know how to access help. It's very important that treatment is integrated and thought of as a whole. So we use a variety of treatment approaches, but they are very closely coordinated around the needs of the individual patient. There is an extensive group programme for all patients on the unit which addresses a whole range of issues, some of them related to eating and meal preparation, others more general issues. So, for example, there will be a group discussing recent events or debating, which is designed to encourage the young people to feel part of the unit, to develop their self-confidence and their self-esteem. With the older patients, we're often working towards becoming more independent and able to function independently when they leave hospital. All patients will have individual psychological therapy with a psychologist or psychotherapist, and the approach taken will depend on the needs of the individual. They will also have regular sessions with the dietitian to look at their diet and particular problems around eating, and the occupational therapist will work with the young person to develop their confidence in managing eating, and that will include going and having meals off the unit in public places and so on, preparing meals on the unit, and developing their confidence to manage their food themselves. Involvement of the family is also crucial. We work very closely with families. We have family therapists working on the unit who will work with the young person and her family to explore issues relating to how she's been managing her eating within the family or any other difficulties within the family environment. And that's an important part of the treatment process.